Support for this program is provided by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund.
First, it was the COVID virus. After 2.5 years of fear, isolation, and disease, we seem to have made progress. But another outbreak is causing concern. And while monkeypox is rarely deadly, it is a disturbing and uncomfortable condition. And now, there's news about polio, the virus we thought was gone. Our experts will present the facts and answer your questions. Plus, we talk with Dr. Anthony Fauci about what's next for him. It's all coming up next.
Thank you to the Eunice Joyce Gardiner Charitable Foundation for its leadership support of the Health Channel.
Welcome to COVID and Monkeypox, the Facts Town Hall. I'm Olga Villaverde, and joining me is Dr. Michael Zinner. He is the CEO and Executive Medical Director for the Miami Cancer Institute. You know, Dr. Zinner, the last 2.5 years have truly been a wild ride for everyone.
Geez, Olga, you're so right. None of us expected what we're into now. Just as we were getting used to a new normal with COVID, we were hit with another viral outbreak, monkeypox. Monkeypox is a mysterious infection causing fear, anxiety, and for some a disturbing sense of déjà vu. But that's not all we're dealing with. For the first time in years, here in the United States, there's a confirmed case of polio. We're here to answer your questions and present the facts about COVID, monkeypox, and polio, and we have an impressive panel of experts to help us do that.
Thank you so much, Dr. Zinner. We also will speak with Dr. Anthony Fauci to get his insights. And a little later in the program, we're going to discuss his retirement from the federal government. So stay tuned for that. But first, let me introduce our amazing panel. Dr. Debra Houry is the Acting Principal Deputy Director of CDC. Dr. Carlos Del Rio is the Associate Dean of Emory University School of Medicine. And Dr. Eileen Marty, a Distinguished University Professor of Infectious Diseases at Florida International University. We welcome all of you. Thank you so much for your time. Now, before we begin, I'd like to remind our viewers, please, it's not too late to email us your questions for the panel. So please email us right there to questions@allhealthtv.com. That's questions@allhealthtv.com. Dr. Zinner.
We want to start with the new COVID booster. It provides protection from the original COVID virus and also the Omicron variant that has been the source of the most recent infections. I asked Dr. Fauci about the need for this new booster, and here's what he had to say.
Anyone 12 years of age or older for the Pfizer vaccine and 18 years of age or older for the Moderna vaccine should get the updated BA.5 vaccine shot within 2 months of the time they got a last shot, 2 months or more. Anybody who's been given a shot 2 months ago, 3 months ago, 4 months ago should get it. If you were previously infected, you should wait at least 3 months before you get it.
And I actually got COVID like 6 months ago, so I actually can get it right now, which is great information. Now, Dr. Zinner, with fewer masks and restrictions, some people may be wondering if they even need a booster.
Dr. Fauci definitely thinks we still have a lot of work to do to get COVID under control. Let's listen to his response.
We want to get the level so low that it doesn't disrupt the social order. And right now, even though we're approaching some degree of normality, we still have situations where it is impacting our daily life. I believe we're going in the right direction, and I would hope that as more people get vaccinated, particularly now with the availability of an updated vaccine that is specifically directed against the circulating variant, the BA.5, I would hope that we get more people vaccinated, and those who are vaccinated, we get more people boosted, because that is the way we are going to get to where we all want to be, where the level in the community is so low it doesn't disrupt us. I don't think it's ever going to disappear completely.
Dr. Houry, let me turn to you. Omicron seems to be decreasing. Will the new booster protect against new variants that may come up?
So, as Dr. Fauci said, it's so important to get this booster, and the updated COVID-19 vaccines can both help restore protection that has waned since the last time somebody was vaccinated, but it also provides broader protection against newer variants. So very much important to get it.
Dr. Del Rio, this new booster, as reported, hasn't been as extensively tested as the other shots. Is that an issue? And if so, how long would we have to wait to know?
Well, Michael, first of all, thank you for having me in your program. This is always incredibly informative and very important information for your public. What I tell people is every year we get a flu shot, right? And the flu shot is based on what is prevalent, what the WHO committee thinks is going to be the most common variants out there of the flu. Typically 2 influenza A and 1 influenza B strain are put into the vaccine. And we have no idea about the efficacy of the vaccine ahead of time because it's not tested. We only know in retrospect when we say at the end of the year, well, this vaccine was a good match or it wasn't a good match. So when I look at this vaccine, this change in the vaccine, it's a very minor change. So I'm not worried about safety. I am worried about efficacy. We really don't know the efficacy. We suspect it's going to be helpful. It should be helpful, but we will really only know in retrospect if it was helpful or not. But I want to assure people that the safety is not an issue because we know from where the vaccine was developed initially and was tested initially that this technology and these vaccines are safe, and the change in the antigen is very limited and very minor and should not be an issue.
Thank you, Dr. Del Rio. Dr. Marty, what can doctors do to reassure people the new booster is safe and, quite frankly, necessary?
So let's start with what is it? We're talking about a vaccine that has 2 components, as Dr. Houry said. It has the original formulation of messenger RNA, and it has a new formulation that captures the Omicron variant. And it was tested as Omicron 1. It's just that because what's circulating in the United States right now is mostly B.5, a different Omicron, and also B.4 and 4.6, and those are far and away what's circulating, a decision was made at the 11th hour to tweak it just a tiny bit more so that it was more ideal for exactly what's circulating. So first of all, it was tested as a bivalent vaccine and found to be safe and more efficacious in humans. Then, because we didn't test it in humans, we didn't have time with the BA.5 and 0.4 slight tweaks, really tiny tweaks. We tested it in animals, and there it showed to be more efficacious. So what we're getting when we get a bivalent vaccine, like we're going to get now, we're going to get a reminder of all those things that are remembered by the virus, the parts that are constant, that don't change, and that are very important for keeping us out of the hospital, plus these little tweaks to lower the risk of even getting any symptoms whatsoever. So this bivalent is a really smart idea, especially as we head towards the fall, where in the last couple of years, there's been an upswing. So we want to dampen that possibility this time by getting this new bivalent vaccine.
Dr. Marty, a quick follow-up. Who's eligible for this booster? People over 65? Are my patients at Miami Cancer Institute eligible? Or even let's take an example of a healthy 40-year-old that's never had COVID.
That individual should get the original series of vaccines if they've never had COVID, and then get their booster at the appropriate time intervals. Right now, anyone who has been vaccinated and it's been more than 2 months since their last vaccine dose or their last booster dose and is 12 years old or over can get the Pfizer vaccine. And anyone who is 18 years old or over can get either the Moderna or the Pfizer bivalent vaccine. And it's so that you do have to pay attention to what they've experienced in the past and when they experienced it. If you look at human studies, we know that it works. The immune system works best after 3 months for a booster, but 2 months is good enough, especially when we're looking at a possible rise in cases coming in the fall.
Great information. Thank you, Dr. Marty. Now, COVID cases seem to be declining, and the majority of people have been vaccinated. Let's take a look at this graphic. Nearly 70% of adults are fully vaccinated, and nearly 80% have received at least one dose of the vaccine.
Dr. Houry, those numbers sound pretty good to me, but are they high enough to stop the spread of COVID? And more importantly, what can we do to encourage the rest of the population to get vaccinated?
So, great question, and these numbers are not high enough to stop COVID. Vaccination is really important to prevent severe illness, hospitalization, and death. And so if 80% are vaccinated, there's still 20% that are really at risk for death and hospitalization. The other thing is when we're looking at, as Dr. Marty said, after a period of time, your immunity starts to wane. So for some of those people who had that vaccine over a year ago or even longer, they need to get that booster so that they are protected now. What can people do? How can we encourage them to get vaccinated? I think looking right now as we're starting to think about flu season, well, you can get both shots. You can get both the flu shot and the COVID shot to protect yourself against these viral illnesses. And then just know what's around you. We have the community levels for CDC. So if you haven't been vaccinated and you see that your community is experiencing high rates of COVID, don't wait. Now is the time. So really know what's going on around you and protect yourself.
Thank you, Dr. Houry. Now, older children have also been lining up to be vaccinated against COVID. Take a look at this. 60% of children ages 12 to 17 are fully vaccinated. So are a little over 30% of children ages 5 to 11. But only 3% of children 6 months to 5 years have received a dose. Dr. Del Rio, let me turn to you. Do you think that's an issue with children going back to school, daycare, or kindergarten? And what can be done to get more parents to vaccinate their young children?
Well, I think we have a problem with vaccine acceptance, and a lot of what needs to happen is we really need to communicate the benefit of the vaccines and what are vaccines good for. And there's been a lot of confusion, a lot of confusing messages. We first said the vaccines were developed to prevent severe disease and death. Then we discovered that they also were pretty good at preventing transmission, but then we had the Delta wave, and all of a sudden they weren't that good at preventing transmission. And then we had the Omicron wave. So we've been not good at all at messaging what does vaccines do for you and how do they help. Children with COVID don't get as sick, but they still can be hospitalized. They still can die. They still can end up in the ICU. And if I'm a parent of young children, I want my kid, if they get COVID, to basically have a mild illness and not to end up in the hospital. So we need to message that. We need to be very clear about why you need to get kids vaccinated. I also tell people, I personally, as Michael knows, I have 4 grandchildren under the age of 5, and I have encouraged my kids to get them vaccinated, and they have vaccinated their kids because they obviously don't want to end up in the ER. They don't want to end up in the hospital. My granddaughter, age 2, had COVID, and she, had a very mild respiratory illness just because she'd been vaccinated. So I think it makes a big difference. Now, one thing that I do want to say, Mike, and I think it's important, is that I think that number of receiving at least one dose is a useless number, because one dose of vaccine doesn't do anything for you. I wish CDC removed that from their website, because quite frankly, that's almost like saying, I have a bicycle and it has at least one wheel, now I'm able to drive. It doesn't help you. Especially against Omicron, you need to have received 2 doses and at least 1 booster. And when you see what the percentage of the population has received 2 doses and at least 1 booster, it is incredibly low. And that's the reason why we are still having 500 people die in our country every day from COVID. We got to get people vaccinated and boosted. And we need to really emphasize that getting 1 dose of vaccine doesn't do that for you. You're still going to end up in the hospital. You're still going to end up sick. And quite frankly, we're still seeing a lot of people die of COVID. So we really need to put our efforts in trying to get people fully vaccinated, which means 2 vaccines and at least 1 booster.
We're still seeing people admitted to the hospital at our place with COVID. Unfortunately, it's the group that's not vaccinated. I can't emphasize enough what you just said. What our panelists just said is the importance of getting vaccinated and boosted. And it's important for you, it's important for your family, it's important for your community. It's something we have to do together.
Absolutely, Dr. Zinner.
Olga?
We've got 2 questions coming in from viewers, so I want to take both of them, please, because they're great questions. Dr. Houry, I'm going to give you this first one, if you don't mind. This is a question from Alicia on Facebook. If someone hasn't had any COVID vaccines at all, can they go straight to get this updated booster only? Can you take that, Dr. Houry?
Sure, and the answer is they can't. They need to do that primary series first. So they have to get the first 2 shots, and then they can qualify for the booster. So get vaccinated now.
Okay, and I have another question. Thank you, Doctor. From Gloria. Can you take the shingle shot, flu shot, and the booster all together? Now that's a loaded question. Shingle, flu, and booster all together. You want to try this one, Dr.
Yeah,
Zinner?
I would not recommend that. I remember when I had my shingle shot, or the second shingle shot, I was down for a while. I think you might want to separate them a little bit to see whether you have a reaction to any of them. So I would not recommend that. But I will turn this over to the panelists who have expertise in this area. Maybe we could turn to Dr. Houry on this one too.
And I'd be interested to hear my colleagues as well. The 2 that I think are probably safest or easiest to get at the same time are COVID and flu vaccines, and we do recommend that you can get those at the same visit. And in fact, when I took a family member the other day, I was able to check a box to get both done. Highly recommend doing that.
Dr. Del Rio, your thoughts on this?
I agree with Dr. Houry 100%. Get your flu and get your COVID vaccine at the same time. I agree with Dr. Zinner. You know, I got my shingles vaccine, and it hit me hard. Like, you know, I had fevers, chills. I didn't feel good for 2 days. So I tell people, if you're going to get your shingles vaccine, which is a very effective vaccine, but the shingles vaccine is one of the most reactogenic vaccines. In other words, you really respond significantly because it has the vehicle is Salmonella LPS. You're getting the lipoprotein of a Salmonella. You're going to get sick. I tell people get it on a Friday and take the weekend off because you will not feel well. I made the mistake of taking it on a day that the next day I was traveling to DC, and boy, I could barely get on that plane. I was not feeling well. So it's not because there's going to be interference of the vaccines. It's just simply, you know, that's a vaccine is going to knock you down. Don't take it at the same time with 2 other vaccines. It's just going to be a little too much.
Great stuff. Thank you so much to everyone. Dr. Marty, I'm going to pose this question to you that just came in, and it's from a viewer who writes, my 80-year-old grandfather had a mild case of COVID, but because of his age, we made sure he had the new medication. Great stuff. He recovered quickly, we thought, but then a few days later, he got another COVID infection, which lasted much longer. Now she's wondering, did the medicine not work?
So let's turn this to Dr. Marty. What's your reaction? I'm sure you get this kind of question a lot.
So first of all, antivirals, which is what we're talking about, and that's a presumption because the person asking the question didn't tell me if they took a monoclonal or if they took one of the 3 available antivirals. But let's talk about antiviral drugs. Antiviral drugs will often bring down the viral load and help your immune system win over the virus. And that's great. But sometimes when you take it, and even though it's bringing down the viral load for a little bit of time, your immune system doesn't happen to produce all the best antibodies in that interval of time. And so you get what we call a rebound. And it doesn't just happen with Paxlovid or Molnupiravir, these new antivirals that we're using for COVID. It happens with some of the flu antivirals as well. So it really is, and somebody older, like is being described in this question, it has what we call, and I hate to say it this way, but it's a senile immune system. So it doesn't tend to be as robust in being able to produce the necessary new cells and antibodies as younger individuals can do. So they are more likely to have a little bit of this rebound effect. He didn't probably have a second case of COVID. He probably hadn't been able to totally make all the right cells and molecules during the time that he was taking the antiviral, so he got a rebound.
Thank you so much, Doctor. I do want to pose this question, Dr. Zinner. You can decide who gets it, but this question is from Sylvia on YouTube. Another great question, and we're really loving these questions from our viewers. My dad and I just received the updated COVID-19 booster today. Good stuff. Was it too soon to get? I had COVID back in June, but I do not want to go through COVID like that again?
Another great question. I'm going to turn to Dr. Del Rio. Dr. Del Rio, Carlos, can you respond to that question, please?
Oh, Michael, there's a study that has been made available from Dr. Fauci's lab. In fact, it's available in preprint. It hasn't been reviewed. It was posted in medRxiv at end of August, suggesting that it's waiting at least 60 days is recommended, ideally more than 90 days. So this person is right on the borderline. They got COVID in June. I got COVID in June. I'm going to wait until October, maybe late October, early November to get my booster. But again, it's better to take something, and when this person took it, it's better than not taking anything. And I insist, don't take it too soon. I think 2 months out, this person is probably fine. I would wait 3 months if I could have. But, the information is changing, and we're learning as we go along, and that's part of the issue, right? We get the data, and then we need to change our recommendations. What I'm telling people right now is if you had COVID in the last 3 months and you were vaccinated already, you have what's called hybrid immunity. You are pretty well protected for the next 90 days. You need to just take it easy, and then after 90 days, get your booster and go ahead and, as Dr. Houry said, get it at the same time you get your flu shot.
I want to turn now to this year's flu season. Now, while last year was mild, that may not be the case this year. Take a look at this.
Living Minute, a look at the latest medical innovations changing our lives.
During the COVID pandemic, there's been a steep drop in the number of influenza cases. But this year, healthcare providers say the flu could come roaring back.
We will see the reemergence of influenza in the winter. Just in comparison, in 2020 winter, we were all masking, we were all distancing. There was literally no influenza.
In Australia, where flu season started in May, they've already exceeded their 5-year average. Seasonal flu, like COVID, affects the respiratory system, and those ages 65 and older are at higher risk. That's why the CDC recommends they get a higher dose and recombinant vaccinations. Everyone over the age of 6 months can get a flu vaccine and should get a flu vaccine by the end of October to make sure they're fully vaccinated for flu season.
Dr. Houry, I'm going to reemphasize what we just heard. We're no longer distancing nor wearing masks, and some are not getting vaccinated. What's your and the CDC thoughts about what's coming up in the flu season?
Well, a few thoughts, and one is, we are in a better place in the pandemic, and we've got more tools now to protect against severe illness that we should use. Just like we just heard, things like masking and distancing can really help. And certainly vaccination. And we don't know what to expect this flu season, but we do expect that it'll spread. And the best thing we can do is to get a vaccine. It's the first and most important step towards protection. As noted, everyone 6 months and older should get a flu vaccine. And for older adults, there's a specific flu vaccine designed specifically to provide strong protection to you. And I think we can all do some really common sense preventive actions, like staying away from people who are sick, using good ventilation, good hand hygiene, and wearing a mask when we know that COVID community level is high or at high risk.
All right, before we get to monkeypox, I have another question from Karen. Dr. Zinner, she asks, I've had COVID vaccines and booster by Pfizer. Should I get Moderna and switch it up?
Dr. Marty, I'm going to ask you to take that question. Would you mind about the two different kinds of vaccines and boosters out there?
So we've looked at a lot of studies about mixing and matching and hybrid immunity of different kinds. Dr. Del Rio spoke about hybrid immunity from having the infection and having had a vaccine. The data is a little bit mixed, but overall, going ahead and trying a different messenger RNA vaccine might give you a slightly different view of the spike and theoretically could give you a little better protection than continuing with the exact same vaccine. However, now, since it's a bivalent vaccine anyway, you're already going to be seeing some differences in the spike because you're getting an original version and the other one, the new Omicron B.5, B.4 version. So really, it's what's available is your best decision.
Okay, Now let's talk about monkeypox. There are thousands of cases in the United States, and that number continues to increase.
We asked some people what they thought, and here's what they had to say. Take a look.
Yes, I am a little bit surprised about the monkeypox, but you know, usually whatever occurs overseas usually ends up in the United States.
I think I'm not really worried about monkeypox. I have researched it, looking online. There's plenty of news stations that are now carrying things. Of course, sometimes we know that news stations like to sensationalize a lot of things, but if you are prudent and do your research, I think you can get all the information that you need from somewhere.
I'm not sure there is enough information. I try to stay informed, but you know, there's as many people out there giving misinformation, whether it's intentional or not, as there are people giving good information.
I'm not 100% sure how you get monkeypox. I think it's skin to skin is what I've heard from how it's transmitted. So I'm married. I'm not really worried about catching it, but I know some people, younger people, have more concern about that.
To some extent, yeah, I am confused about how it can actually be transmitted, the monkeypox, how it can be spreaded. I just think all precautions need to be taken. And so therefore, I know me personally, I'm trying to take all precautions.
I'm concerned because we stopped giving out smallpox vaccinations, I think in 1972 or 73. And look what happened. We have this monkeypox that has come back. I think maybe we need to rethink, should we quit giving these vaccines? And I think we had a case of polio also. So I don't have to worry about it. I had the smallpox vaccine.
As we just heard, there's some confusion about how this virus is transmitted. So we asked Dr. Fauci about this, and here's what he had to say.
We know very clearly right now from the epidemiology that overwhelmingly between 97, 98% of all the cases are among men who have sex with men. And the mode of transmission is very close, and in cases prolonged, more than just casual, but very close skin-to-skin context. And if you look at the placement of the lesions, many of those are around the genital areas, which means it very likely is the sexual contact, which is very compatible with the fact that we're seeing more than 98% of the cases among men who have sex with men. So the bottom line is it's close, personal, prolonged skin-to-skin contact where you have lesions on the skin that come into contact with another person.
Is there anything else we need to know about monkeypox? Does this virus have the potential to mutate into a more severe infection?
Well, first of all, let's get back to, and I should have answered the second part of your question. To prevent this, the good thing about this is that we have diagnostic tests, we have an antiviral drug, and we have vaccines. And one of the ways people can protect themselves is modifying, for example, sexual behavior, at least for the time being, until we can get this under control. And the other is, importantly, since we have vaccines available, get the vaccination, which is something that can protect you, obviously, against getting infected.
Dr. Del Rio, let me turn to you. Carlos, even in my institution at Miami Cancer Institute, we've had to admit patients for monkeypox. I'd be curious to know what the national experience is with both hospitalizations and mortality with this illness.
So, Mike, the great majority of patients don't need to be hospitalized. When we have hospitalized patients, it's because of severe pain or severe organ involvement. So, for example, they may have encephalitis, or they may have significant proctitis with bleeding, or they may have oral pain or esophagitis and they're unable to eat. But the great majority of patients don't need to be admitted. Having said that, I think there is significant morbidity from this infection with significant pain. And I think the rectal pain and the oral pain are two, and sometimes, penile pain and difficulty urination, difficulty having a bowel movement, and with pain and bleeding, to me, are some of the more significant symptoms of this disease and that require management. So management of the pain, I think, is very important. And in those patients, we have also used antivirals. Mortality is pretty low, but you're absolutely right. Patients who are immunosuppressed, either people with advanced HIV or people with cancer, people with immunosuppressive therapies, may have more severe disease. And those that have more severe disease or are likely to have more severe disease, we want to start them on antiviral therapy as sooner as possible and treat them with antivirals. And having said that, we still don't have good data whether the antivirals really make a difference, whether they really make patients cure faster or decrease the duration of illness. Current clinical trials are currently being conducted. There's a lot of anecdotal reports of people saying, yeah, they started the antivirals and they got better. But you and I know that without clinical trial data, anecdotes sometimes go away. The best example I give people is, when I was training, we all thought that steroids and pneumococcal meningitis were lifesavers, and then a clinical trial was done and clearly debunked that myth. Steroids made no difference in the management of pneumococcal meningitis. So clinical trials are critically important to answer those questions about efficacy, about safety, and about impact in prognosis against the disease.
Dr. Houry, Blacks and Hispanics seem to have a higher rate of monkeypox than other racial groups. What are some of the causes for this?
So, the largest proportion of cases have occurred in white persons, but you're right, Black and Hispanic persons, who represent approximately a third of the general population, account for more than half of the monkeypox cases. And we've also seen with our recent data that cases among Black persons is increasing over these past few weeks. There's a few things we can do, and it really is around ensuring equity and approaches to monkeypox testing, treatment, and prevention. And we really need to take actions to minimize stigma related to monkeypox. All these things can help reduce barriers to seeking care and prevention. I also think this is where it's really helpful to have trusted members of the community talk about monkeypox. It's very helpful to have people from similar demographic groups talk about it so that you can reduce that stigma and make sure access to treatment is available to all.
As a follow-on to Dr. Houry's comments, it appears that there's a stigma associated with being diagnosed with monkeypox. We asked Dr. Fauci about this, and he addressed that in our interview.
Although this is predominantly in the demographic group of men who have sex with men, it is not a gay man's disease. It can potentially infect anyone when you have a situation where you have close skin-to-skin contact. But obviously, we're not seeing that spill over into other populations, which is good. But don't underestimate an emerging infectious disease unless you get a lot of experience about what the pattern's going to be. That's point number one. Point number two is that we should make sure we don't stigmatize the group that is most afflicted by this particular infection. The enemy of public health is stigmatization. So if we learned anything in the past, particularly from the early experience with HIV, is you don't want to stigmatize the people, in this case, men who have sex with men, because they happen to have a virus that was inserted into that demographic group and is spreading predominantly there. That would be the worst thing that we can do.
Dr. Zinner, that is really true. Stigma is the enemy.
Exactly. Dr. Marty, a new version of the smallpox vaccine is being made available for protection against monkeypox. What's the connection between these two diseases?
So the vaccines that we use for orthopox viruses, and smallpox is an orthopox virus, monkeypox is an orthopox virus, is a different orthopox virus called Vaccinia that has a really interesting history. Now, what you're calling new is a modified, so it's attenuated. It's not able to grow in our cells. It only grows in chick fibroblasts, the little embryos of chickens. It can't grow in our cells, and that makes it weaker in terms of being able to cause anything bad in us, but it retains those common features of orthopox viruses that protect you from both smallpox and monkeypox. And so that's the vaccine we're talking about. It's not really very new. The technology and the paper that it's based on was published in 1971. So it's really not that new. It's only that it's been newly approved and tested for this purpose. And it was approved originally a couple of years ago and again now. with a new way of providing this vaccine, which is in the dermis as opposed to subcutaneously. And there's good data for switching over to this new methodology of giving it. And by doing that, we're able to expand our total vaccine available 5-fold because we give 1/5 the dose.
Thank you, Dr. Marty. We're going to turn to polio next, but first I want to get to this viewer question from Mia. She writes, can monkeypox be transmitted if a person has a blood transfusion?
I'm going to ask Dr. Houry to help us answer that question. Can it be transmitted by another method beside contact?
So right now, the way that we know that monkeypox spreads is really just direct contact with the rash, scabs, or body fluids, or touching objects, fabrics, and surfaces that have been used by someone with monkeypox, or contact with respiratory secretions.
Thank you so much, Doctor. So another virus that we thought had been eradicated in the United States, polio, has returned. Take a look at this graphic. Every year in the late 1940s, over 35,000 people were disabled by the virus. In the early 1950s, over 15,000 people were paralyzed every year. But after the vaccine was introduced in 1955, that number dropped to less than 100 cases yearly in the 60s and less than 10 in the 70s. Then, in 1979, the disease was declared eradicated in the U.S., and there had only been 3 known cases here until now.
And in my conversations with Dr. Fauci, we discussed polio. Let's see what he had to say.
Polio is entirely avoidable. The vaccines that we give to our children is 99% effective in preventing polio. And so it's very important to get the children vaccinated. The case of the paralytic polio in Rockland County, New York, was in a county where only about 60% of the people are vaccinated against polio, and in certain areas within that county, as low as 37%. This is an entirely avoidable disease, and that's the reason why we require polio vaccines in many of the schools throughout the country. So the way you look at this is to say, you and I would not even be talking about this if everyone got vaccinated against polio, which is available to everyone in this country.
So, Dr. Marty, most people are not used to thinking about polio. So how is this virus transmitted?
So this is a fecal-oral transmission. So basically, you're going to be consuming, say, a sandwich that was touched by somebody who went to the bathroom and didn't wash their hands before they made you that sandwich. So what we're talking about is we're in water or food that's contaminated, or even the fingers from somebody whose hands are contaminated with the virus. You can consume this virus, and then it will, in a very small percentage of the people who get infected with the virus, it can produce paralytic polio.
Dr. Del Rio, I don't want to get too technical, but I think the public needs to understand the difference between oral vaccine-derived poliovirus and the wild type of poliovirus, because that's being written up in the lay press a lot.
So let me explain it. The first vaccine developed for polio was actually an inactivated vaccine. It was an intramuscular vaccine. It was the one developed by Jonas Salk, the original polio vaccine. But then Dr. Sabin developed another vaccine, which was really brilliant. It was an oral vaccine, and it included an inactivated virus. And the idea of giving that vaccine, which was critical in the eradication of polio, is that kids got vaccinated, but also kids started stooling in developing countries, that went into the water supply. And then other kids who hadn't been vaccinated, when they drank that water contaminated with fecal material, they also got the vaccine. So in a way, it got people vaccinated in a very sort of interesting way. But at the end of the day, that increased vaccination rates in a very important way in many developing countries and allow us to get very close to polio eradication. At some point in time, a couple of years ago, we started to realize the problem with the inactivated vaccine is that occasionally that virus, which is an inactivated virus, can cause a form of paralytic polio, which is called vaccine-derived polio. So at some point in time, the U.S. Public Health Service and other countries said, you know, we need to stop using the oral vaccine because the risk of vaccine polio is higher than the risk of wild polio. So we moved into the injectable vaccine. We went back to the inactivated vaccine. And if you get the inactivated vaccine, you're protected. And as Dr. Fauci says, this is a highly effective vaccine, whether you use the intramuscular inactivated or the oral, you know, sort of, you know, the live vaccine or the dead vaccine. Very effective vaccine. I tell people, polio is a disease you can prevent, but you cannot treat. There's no treatment for this disease. Then, but if the vaccination rates go down, what Dr. Fauci mentioned, you know, in New York City, for example, there are 10 zip codes where vaccination rates against polio in kids are now around 40 to 50%. So that means 40 to 50% of kids have not been vaccinated with either vaccine against polio. Somebody who's received the oral vaccine in a developing country or in other countries who are still using the oral vaccine comes to New York, stools in the water supply, and then, or you know, goes to a daycare center or whatever, and then infects another person. That person can get the paralytic polio because they're not protected with the vaccine they needed to be protected. And that's the problem we're seeing right now. We're seeing vaccine-derived polio causing polio, and something that we shouldn't have seen if people had been vaccinated. So again, emphasizing the need for vaccination, high vaccination coverages are critically important in the polio eradication. This is a disease we got so close to elimination. It is really, you know, is really incredibly frustrating to people like me that we're seeing what we're seeing right now.
Thank you, Carlos. In fact, that brings us to a question by one of our viewers.
That's right. They write here, Dr. Zinner, I received my polio sugar cube in the 50s. Am I covered or should I get updated polio inoculation?
So, Dr. Houry, I wonder if you could answer that question. Take it from the perspective of the CDC.
Sure. So great question, you know, and it's not known how long people who receive the polio vaccine will be protected, but they're most likely protected for many, many years. We did a survey about 10 years ago, and it showed a very high percentage of children and adults had protective antibodies against polio, including adults who had received that sugar cube vaccine as children decades earlier. And most adults, you know, have likely already been vaccinated against polio during childhood, and that's why it's not part of the routine adult vaccinations. If you are unvaccinated or incompletely vaccinated, then you need to get that polio vaccination. But if you received the vaccination as a child, you're most likely protected many, many years later, and we consider you to be vaccinated.
Dr. Houry, I have another follow-up question from a viewer here. A parent writes, my family is suffering because of the overwhelming negative impact on my children's mental health caused by the pandemic. We really are at our wits' end trying to help the kids and survive ourselves. What can we do? This is something that I've heard a lot, Dr. Houry.
Well, first, I just want to say my heart goes out to everybody that's been impacted in a way like this. There's a few things, and one is there's now a 988 number. So if you are ever thinking about hurting yourself or you're worried that someone else is, you can call and immediately get linked to a counselor and get help. There's a lot of things we can do to protect children and to really protect mental health. And I think it's about kind of those building blocks for resilience. And so things like having stable relationships, having a caring adult, really focusing on connectedness are really important. Physical activity is really important. Even though there was some of that social distancing, kids were able to connect via FaceTime, like to grandparents or to friends, and that's really important. I think just asking children how they're feeling. On CDC's website, we have information that helps kids and families cope with the pandemic and with these stressors and has different activities that you can do, as well as how to cope. But what I want to say is just being there and asking about someone really makes a difference. It's so important to be there and to be that friend and that supporter and support that connectedness.
Absolutely, and letting people know you're not alone. Thank you, Dr. Houry. So we're coming to the end of our program, and before we get to final thoughts, we want to discuss Dr. Fauci's announcement about leaving public service. Take a look at this graphic. He's been the director of the National Institute of Allergy and Infectious Diseases since 1984. He has advised 7 presidents and was one of the principal architects of the president's emergency plan for AIDS relief. What a resume.
We asked people on the street what they thought, and here's some of what they had to say.
I think Dr. Fauci did a wonderful job based on the fact that no one knew all the facts about the different type of vaccines. I think Dr. Fauci did a wonderful job.
I think he's done an amazing job. He was on the TV, had to answer questions off the cuff, and people don't realize that as scientists, there's never a definite answer. They're doing the best they can, and yet we as human beings and the public want to know yes or no. We don't want any gray areas, but that's just not the way the world works.
He's worked hard. He's done a lot of good things for Americans. I think COVID, there's a lot of people that think he could have done a better job, and then some people that continue to support him. But overall, throughout his career, I think he's done a lot of great things with AIDS and helping those people be serviced in a way that they weren't prior to Dr. Fauci stepping in.
I think Fauci did an excellent job in what he was doing for the public in regards to the diseases and COVID and everything else.
I hope he enjoy his retirement. Good for him. And the next one that comes along, but I do believe he served the purpose. He gave out some really good information, helping us to protect ourselves, and it's helped. It's really helped.
I thank him for his service. I'm glad he was around. And let's not forget, he was one of the reasons that we had the successes we did have in dealing with the AIDS epidemic a couple of decades back. So thank you, Dr. Fauci.
While Dr. Fauci is leaving public service, that doesn't mean he's going away. We spoke about his future plans, and here's what he had to say.
I'd like to get myself into a situation where I can do writing and lecturing and being in situations where I might serve, given the 54 years of experience I have at the NIH and the 38 years as the director of this institute, and having had the privilege of advising 7 presidents, that I might serve as perhaps an inspiration or a model for people, young scientists and would-be scientists, to perhaps inspire them to choose a career in public service, particularly within the context of public health in the realm of science and medicine.
You know, Olga, no one in the history of public health has had more of an impact on this complex world of infectious diseases than Tony Fauci.
You're so right, Dr. Zinner. He has had a tremendous impact on public health, and we thank him for all that he has done.
I asked him about his accomplishments, and let's hear what he had to say.
I would like to be remembered for someone who tried their very best to use what talent they had, what position they were in, and a lot of hard work to try and protect and preserve the health of the American public. And since the United States is such a leader in health and science, to indirectly have a positive impact on the health of the world. That's what I've tried to do as a scientist, as a physician, as a clinical investigator, and then as the director of a very large infectious disease and immunology institute. So I would hope that people would remember me for what I've tried to do and I believe accomplished.
Great stuff there. Viewer question that I want to get to, and this is from Cheng. How can I tell who is infected with monkeypox?
You know, I'm going to ask Dr. Marty, can you respond to that question? How can we tell who's infected with monkeypox?
Well, generally, someone who's infected with monkeypox, once they're symptomatic, is quite well aware, because generally it's very, very unpleasant and very painful. But how do I know that someone else has monkeypox? That's a very challenging question if they're not coming to me as a patient, because an individual, there are documented cases in Belgium and in France of asymptomatic people with very high viral loads, and we still don't know what that means and whether that person can transmit or not. But you've got to go back to the basics for every infectious disease. How is it mostly transmitted? And we already know that skin to skin, but really what we're talking about is rubbing a lesion, which happens during sex, and so that you break the skin and you allow that thing to get in, or you allow it to get into a mucosal surface. You have to understand where your risks are. For any infectious disease, how do you get it? And so how do you reduce the chances of getting it? Depends on how you're most likely to get that infection, and bearing that in mind.
Thank you, Doctor. Another viewer question, and we thank our viewers for chiming in. This is from, actually, they don't have a name, but if you're 38, for example, and had a pediatrician and went to public schools, is that person vaccinated for today's outbreak with polio? And I should mention it's polio.
Right. Dr. Houry, you're on.
So I would say likely, but still check your vaccination records because all school districts have different requirements.
Okay. Now, before we go, we'd like to get some final thoughts from our panel, and we have about 5 minutes left. So, Dr. Houry, I'm going to start with you.
Sure. Well, and thanks again for having me tonight. I just want to say at CDC, our staff work tirelessly 24/7 to really focus on protecting the public. And as we head into fall and winter, which we know are respiratory virus seasons, people can take action now to protect themselves by getting an updated COVID vaccine and their annual flu vaccine. And for anyone with questions on the areas we covered tonight, you can visit cdc.gov for the latest health information.
And Dr. Del Rio, your thoughts?
Well, first of all, I want to say that Dr. Fauci, as you mentioned, has been an incredible leader and has been, to me, a friend, a mentor, and a colleague. And his not only the advice he's given the nation, but the number of times he's testified in front of Congress, it's really remarkable. I mean, I don't think there's anybody in public service who has testified in front of Congress so many times, and his ability to communicate is really something that we should all strive to learn from. This has been very difficult times, Michael, and I think we need to be more caring, we need to be more kind, and we need to really, sort of decrease the heat and stop really thinking about how do we as a society work together to get out of problems. And I think, monkeypox and flu and this is things that the world will continue throwing at us. And what we need to do is we need to advocate for continued support for research, because research has been critically important in getting us out of this problem and many other problems in the future. So continue to advocate for the support for research, but continue to advocate for the support of public health. Strong public health is the best defense we have against this kind of problems. And we have severely underinvested in public health throughout many, many years. And I think it's time that as a country, we really dedicate the resources to public health that are necessary in order to better protect our population.
Thank you, Dr. Del Rio. Dr. Marty, your final thoughts.
First of all, it's been an honor and a privilege to be with Dr. Houry, Dr. Del Rio, Dr. Fauci, Dr. Zinner, and you, Olga. It's always a pleasure to be with you. I just want to say that I completely concur with what Dr. Del Rio was just addressing on public health. It's vastly underfunded and vastly underrated in the United States. And not just public health, but we need to get to a place where we have a better health system, a true health system, which is one of the reasons that the United States has not been able, despite our enormous wealth, knowledge, and brilliant people in wonderful positions, been able to really get our arms around these new pandemics and why we always turn up with so many more cases than many other places. We've got to get our health system to be a true health system.
Thank you, Dr. Marty. I don't want our panel to leave quite yet because, as we always say, our viewers are very important. So I have 2 more questions, and we still have about 3 minutes. So let's get to these. I like this question from Michelle. It's on Facebook, and it writes, I am fully vaccinated and boosted and always wear an N95 mask when I'm around people. I still got COVID while on a cruise. I believe I got it from my husband, who is not as thorough with his mask. That's very cute. Should I still get the new booster?
Let me turn to Dr. Houry. You want to answer that one, please?
Sure. And I missed when the date of the cruise was when she had her COVID infection.
She didn't say it, but she did say her husband's not complying very well with the masks.
So what I would say is, as I believe Dr. Del Rio had said earlier, if it's been a few months since that infection, then get the booster. But if the cruise was just last month, she can wait a little bit longer. And I'm delighted to hear she's been following our guidance and wearing masks and staying up to date with her vaccines.
That's right. Thank you, Michelle. Want to get this one really quick from Del. Is it true that if you are under 30 and healthy, that the pharmacy will refuse to give you Paxlovid when you have COVID?
Dr. Del Rio, can you help us?
20 seconds, Dr. Del Rio, please.
Well, the data shows that if you are under the age of 65, you get very little benefit from taking Paxlovid. So yes, I mean, they refuse because, quite frankly, there's no benefit. of you taking the drug. So don't take it, but if you're over the age of 65, it's indicated. It decreases the risk of severe disease. So we need to use drugs in the appropriate population at the appropriate time. And somebody under the age of 30 should not receive it. We have very good data to show that that's the case. Now, if that person under the age of 30 is an unvaccinated person, that's a different story. If that person under the age of 30 has significant underlying diseases and immunosuppressant, so that's a different story.
Thank you.
But, my son who's 30, my recommendation is don't take Paxlovid.
Thank you, Doctor.
That's it for tonight. We want to thank our panel for taking the time to share your wisdom and insights with us. We're grateful to you all.
It's been a great hour, great information, and we hope you enjoyed our town hall. We thank our viewers for giving us your time, your questions during this town hall. I'm Olga Villaverde, and along with Dr. Michael Zinner, we hope you stay safe, enjoy your family, and any last words? You got about 10 seconds.
We learned a lot tonight. We certainly learned a lot about all three of the diseases we're talking about. And I think it put my mind at ease about many of the things we had to worry about. And I hope it put your mind at ease in our audience. Thank you.
That's right. Get your booster. I'm Olga Villaverde along with Dr. Michael Zinner. Have a great evening.
Thank you to the Eunice Joyce Gardiner Charitable Foundation for its leadership support of the Health Channel.
Support for this program is provided by Baptist Health through the John and Margaret Krupa Distinguished Chair Fund.